how much it will take to maintain his dentistry?
I don't know how long the bank. A lot of times, I think the repayment may be on a 6, 7, 8 year note, and so I wouldn't be able to tell you the numbers, but the banks, the banks know, they have experience with where they're going to want to see kind of what are the total gross receipts that an office, what do they anticipate in terms of a business plan, where are they if they have a home mortgage, are they married, are they single, is the wife or the other the husband, if it's a female dentist, what's their combined income. So a lot of those factors are going to come into play.
But dentist with the 5 years or 5 years practice, how much can he earn in average, for example, in Houston, in Texas?
That's a difficult question for me to answer, because I would say one that I don't think dentistry. I think I would do it again. Dentistry is not a profession to go into because you think you're going to earn a lot of money. You might generate a lot of money in the office, but the office expenses are extremely high.
Yes.
And historically, that's people in the business community in banking. I mean, they know, and that's they know that dentistry requires a lot. A dental office is almost like a miniature hospital.
Yes, of course.
In stark contrast to if we were to visit an allergist or a family practitioner, an internist, when we walk into their office, it's an office that doesn't require a lot of equipment, and a dental office requires equipment that runs parallel. It's certainly not hospital expense, but there's I mean, you could each of the operatories, the amount of money that is attached to the walls, under the drawers, the seats, the lights, it's like a little miniature operating room.
Office generates money, and all this money goes on the growth of the business, renewing equipment, hiring staff, right? But in general, how much a dentist can bring home after all these expenses in the 5-10 years after practicing? No, average 150,000, 200, 250, half a million.
I think, that now you put some numbers out there. I do not think many dentists doing the work that I do are making $500,000 a year. I think you would also have to understand there are different ways of different types of practice philosophies. So I have never made it has never been a goal to see how much money I can earn. My goal has always been, how can I take care of the people?
Yes.
And there's a very positive side of that, but there's also a negative side, because you cannot ignore the numbers.
Yes.
And you wouldn't take your car to an auto shop.
Yes.
If you knew the auto shop was running in the red.
Yes.
So in this office, we strive to take care of patients and try and do the right thing the right way at the right time, and then allow the money to take care of itself. So I often don't even know how much we make, but I will tell you that by and large, I think you can be comfortable. But I want to answer the question. I think that in the neighborhood of 100 to 150, 160,000, I think would be an income that one, after 5 to 10 years, can make. There's a big variation in regard to, just I mentioned, kind of the practice philosophy, the approach that you take. It's important to me, since I mentioned cars, that people are real. People are not cars. And so in this office, we try to take care of people and not treat them
Yes.
like anything other than people.
Mm-hmm.
Often a patient will ask me, how much will this cost to do this procedure? And I honestly don't know.
Yes.
And I have found that that is an easier place for me to be.
Mm-hmm.
And I can talk about numbers if I have to, but I need a timeout to get numbers together.
Yes.
It's easiest to talk about because there's so many different options, and this goes to the different approach of dentistry, where there are different ways to solve problems.
Mm-hmm.
And among those different ways,
Mm-hmm.
it's elements of how long might this take and different approaches to solving a problem. And some approaches aren't solving the problem, they're just moving it down the road
Mm-hmm.
to maybe a more opportune time
Mm-hmm.
to deal with it. And so when I talk dentistry and money, I often desire to talk about the dentistry by removing the money
Mm-hmm.
in the hope that we can talk what is the best thing to do
Mm-hmm.
and what are the options, and then at that point bring the money back into the equation and how can we get there.
Mm-hmm.
So I'm not sure I answered your question.
Yes, and so, no, but in average, our audience is interested how much dentist can bring home. No, 200,000 he can bring, 250,000 in a year. With this approach, with humanic approach, when you don't try to rip off your customers, yes, when you serve them and you give them fair prices, is it possible to bring 250, 300,000?
Well, I think there are some that don't. This office doesn't do that.
Mm-hmm.
I just don't
Mm-hmm.
concern myself.
Mm-hmm.
I like to sleep well at night.
Yes, I understand.
And I like to be happy when I wake up in the morning.
Mm-hmm.
And I honestly believe that if we fulfill the goal of taking care of the people, I sometimes think it's in regard to careers. I think it's really, really important to find what you're most interested in doing, what your gifts, which gifts you have, how do they open doors,
Yes.
and then pursue that. Now, I know you have to be realistic because somebody could, I think one of the best examples would be somebody who's just really, really artistic.
Mm-hmm.
And they quickly discover that their passion for art is not putting food on the table.
Yes.
I think I understand that, but I wouldn't want them
Mm-hmm.
to forego the passion. They just may need to find something else
Mm-hmm.
to do. And they may not be really passionate about that something else,
Mm-hmm.
but I think at least I feel I have seen and met too many people who can't wait to retire.
Mm-hmm.
And I'm not sure retirement is necessarily a good thing. It's not necessarily a goal of mine to quit dentistry.
Yes.
And that's why I think, that being able to work at what you enjoy doing
Mm-hmm.
and enjoy doing it as long as you can, and then there are other aspects. It's not so much what you bring in, but maybe how much you're spending on the outside in terms of the quality of life.
Is this business stable? Is your business stable?
I would say yes.
Mm-hmm.
I think there's a couple different layers there. Stability could be defined both in terms of an office environment, but certainly dentistry is susceptible because so much of dentistry is done with discretionary spending. There are some things that can be postponed, and then there are certainly some things that have to be addressed immediately. But the other answer in regard to stability is if you have a dental practice built upon relationships with your patients, if those relationships are good, then you have built in stability that can carry you through, say, downturns in the market.
Can you tell me, the last question, if you will decide to retire, you will be not able to work anymore, is it possible to sell the business? Dentistry?
Yes. In fact, probably most offices go through a transition like that, but I think there are also other ways, rather than retire and sell a practice, one could transition out and maybe begin working part-time as somebody else is stepping in, and that's a very favorable situation if it's done well and done properly for both the patients, the young dentist coming in, and the older mature dentist making an exit. That if you could have a smooth transition, it's a win-win-win.
Okay, Frank. So we see that this is good and stable business. It takes long time to enter, and it takes some efforts to organize your own dentistry. But business is stable. It for all your life. It brings you satisfaction. It brings sufficient income. It allows you to make a decent living during many years. And then quitting this business, you can continue to receive income from the business you created. Am I correct?
Correct.
Good. Frank, thank you so much. It will be a great deal for our audience to know what it takes to come to the business and what to expect from the business, and the most important thing, how then to exit out of this business. Thank you so much and be blessed. Thanks a lot for your time and interview. Guys, we were with Frank Dunlap, DDS, and Vladimir Mikhailenko run this show. Thank you. Bye.